And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about all different procedures. Let's see, we talked about gynecomastia, we talked about tummy tucks, and now eyelid surgery or
blepharoplasty.
Thank you.
There you go.
I just like when you say it better.
It just means eyelid surgery.
All right, eyelid surgery. So let's get right into the pictures because we can talk about it as we go. First picture, eyelid surgery. Who needs it and why?
Well, one reason we need it is it starts blocking our
Exactly.
vision. So in this case, her vision
really
is
see
blocked
that.
up and out. So she's almost like wearing blinders with a visor.
Totally.
So what it does is it's removing that extra skin. Also, if there's some extra fat, we can remove that too.
I like that.
Upper lids, primarily it's the extra skin that causes the most trouble.
So the scar is on top of the eye?
The scar is right in the fold. So when the eye is open, the scar is kind of hidden in the fold.
Oh, I like
and
that.
then in this case, since she has that extra stuff on the side,
Yeah.
I have to extend it up and out a little bit too.
Oh, now since she can't see very well in the first picture, does insurance help?
Sometimes it will.
Okay.
Yeah, usually have to ask them ahead of time and play Mother May I and make sure it's okay.
Exactly.
Sometimes they will, sometimes they don't. Usually you have to have an ophthalmology exam and make sure your vision is right. And,
picture number 2.
So this is someone who has sort of very low folds where the skin is starting to rest on the lashes.
Oh,
and a little bit of asymmetry. And she's got a little bit of an irregular fold too, because the left side has a better fold than her right. So in this case, we're not only removing skin, but trying to create a crease, almost like a double eyelid surgery.
Okay. Now, did you take a little fat out from underneath her eyes?
The lower lids had a lot of extra fat.
I can see that.
So we've
Looks
unstuffed
fantastic.
her bags.
Unstuffed her bags for sure.
Yeah.
It's very natural, the after photo, and the scars are hidden very well, and you probably, they fade pretty quickly anyway.
Fade pretty quickly, and the overall look, if you don't really concentrate on the details, she goes from looking kind of tired to awake and alert.
Exactly.
And that's really the key.
Okay. And that's why most people come in, right? They kind of got a tired look and they got some sagging skin over.
Exactly, exactly. They want to look refreshed.
Refreshed and beautiful. And a downtime for eyelid lift?
Eyelids, it's really how long you can wait before explaining bruises. It takes about 7 to 10 days for the bruise to go away, but otherwise you feel fine right away. Shouldn't be painful.
Next picture.
So this is a younger woman with very irregular folds. So very common in Asian eyelids. About half the time with an Asian eyelid there's a fold, half the time there isn't.
Gotcha.
It can happen with any race though. And in this case, the left side has a fold, but it's low. The right side, her right side, has multiple folds. So what I've done is kind of clean it up, give it one fold on each side, try and make it more symmetrical. And she had a little bit of ptosis on the left side too. You see the eyelid's a little lower on that side. So I tried to raise that and make it more even.
Very natural look. And what is the difference between Asian and Caucasian eyes? Is it usually the fold? Gotcha.
So when there's a lot of attachments there, like a Caucasian eyelid, there's a dominant fold. And usually it's about 9 millimeters up. With the Asian eyelids, not as well attached, sometimes multiple folds, sometimes no fold. And when there is a fold, it tends to be about 4 millimeters, very low. And the problem with that is once you have extra skin, it falls right in your eye.
Exactly. Next picture.
So this is someone also with a little bit of irregular eyelids, but mostly didn't like her lower eyelids. And the same thing here. I haven't done much to the uppers, but the lower lids we've taken care of getting rid of the bags.
And so the scar on the, we know where it is on the upper. Where is it on the lower?
So the lower lid, it's right underneath the eyelashes.
Okay.
And then it'll extend sort of down and out a little bit along the smile lines, so I can tighten the skin.
So natural. And how long does an eyelid lift last as we look at our last picture?
The eyelid lids usually don't need to be redone.
Really?
The upper lids can if the brow sags and we get a little more skin. Lower lids, usually once we've unstuffed it, it's unstuffed. And this is the same as the last person, the same one, but side view.
Oh, yeah.
You can kind of see the
disappearance of that. You really took the fat out underneath her. Right, you did the underneath. Can you do uppers and lowers together?
Certainly.
Okay.
Certainly can.
And a lot of people ask if Botox can help with sagging skin. Maybe you don't have to do the eyelid lift. Can Botox help?
Botox can sometimes give us a little bit of a brow lift.
Yeah.
But I think more commonly you'll have people come in who've had Botox where it drops their brow.
Right,
and
exactly.
Then an eyelid lift might be a better choice.
That is great. So you can do upper lowers at the same time.
And in some cases like this, where it's a younger person, tight skin, we can go inside the lid and not have the scar on the outside.
Oh, that's great. But the scars, fade pretty nicely on
They fade very well. Yeah.
All right, for more information about Dr. Mealy, you can call the office at 925-943-6353 or check him out on the web at either drmealy.com, sanfranciscobreast.com. You can see all the before and after photos. We will be right back on Body Beautiful.